as a doctor in our community, not just as a Black doctor in our community, but as a doctor in our community, but also as a friend. I've known Dr. Jackson since the second time I met my wife. And she questioned me up and down on who I am to see if I was a good fit for her friend, right? And which I always appreciated. We joke about it now. She went to medical school with my wife at UC Davis. She's going to share, part of her journey. So I'll let her speak on her journey. And she's currently a family medicine physician here at Kaiser in our community here in Napa, with special interest in integrative medicine and acupuncture, and been there since 2016. So she moved here before we did. And when we moved here, we're excited to, also have her as a friend here in our community when we moved here. And so, I won't, she's going to share a lot of the other details that I would right now in her talk. So she's going to talk to you a little about her journey and talk to you a little bit about how her story, and connect with her story to the story of our students, as well as leave us with a few thoughts to think about, right? And so without further ado, I am going to pass the mic over to Dr. Kimberlee Jackson. Welcome, amiga.
Great. Hi, everyone. Thanks for having me. And thank you, Louise, for the introduction. I do remember that. All right. So I just wanted to share a little bit of my journey to medicine. And at the end, I have a couple tips that I have for individuals going through the process, and maybe just, life tips to make your journey maybe not as rough. I think that's like the goal of future generations, for your experience to be better and better. So yeah, I am a doctor, family medicine doctor. I've been practicing for 5 years now out of residency. I always knew that I wanted to be a doctor, or rather a healer. I always felt that was my purpose, and I always recognize my family members' medical issues when I was growing up, and I always wanted to be the person to kind of fix their problem and solve it for them. And then I also think that growing up, I recognized that health has an integral role in people's success, or their ability to be, quote unquote, successful. If you're dealing with chronic medical conditions, you're not always going to be able to show up to work. You're not always going to be able to put in 150%. And that doesn't just affect you, it affects your family, your earning potential, the way that, your boss views you, all of these different things, the communities that you're able to live in, all of that affects it. So I feel like health is one of those integral kind of things that affects communities. So yeah, I did well in school. I remember in high school, I was a nerd. I just studied, and I was really focused on that goal of going to college, like being the first one in my family to go to college. And I had like a 4.2 GPA, and I thought I was super smart, and I was so excited to go to UC Davis for undergrad. And then I got there, and we're all moving in and everything into the dorms. I thought it was so cool, like in college, colleges on TV and movies. And then classes started, and then I was like, oh my gosh, I'm not prepared. I was like a top student in my school, in my small town. But when I got to that level, I realized I wasn't as prepared. I didn't have the study skills, and I didn't have the preparation that some of my freshman peers had. So I did struggle a lot. Um, like I went to class. I didn't know that I was supposed to go to office hours or to like raise my hand in, you know, these huge auditoriums full of students. I was just intimidated. And so my first quarter, I did fall behind. And um, then I slowly started to realize that I need to reach out for help. I need to go to office hours. I need to talk to the TAs. I need to get a tutor. And so I was like slowly kind of learning about how to be a successful college student. Um, and um, Another thing I think is a part of being from um, a community of color is that you're not just an individual. And so I was like trying to focus on school, but then I also had all the stuff going on in my family back home. And then my mom was not getting along with my sister, who was still in high school. So at one point, my sister came to live with me in college. And then I was like trying to help my sister to do her high school schoolwork, but I'm trying to do my college work and have a job on the side. It was crazy times for sure, but you can't just forget your family. So I struggled still through the later years of college. I knew I still wanted to be a doctor. It was like a dream of mine. Um, and then I heard about a summer enrichment program through UCLA called UCLA Prep. So I applied to that, and um, I ended up getting accepted for the summer. I think it was like 4 or 6 week, something like that, intensive kind of a program. And it was awesome. That was the turning point, I think, in my educational journey. When I went there, I met all these other students who were in the same boat as me. Many of them were from struggling kind of backgrounds or disadvantaged financially or in other ways. And we all had the same common goal, that we wanted to be physicians. We wanted to help our communities. And that program was awesome. Because of the components of it. It was not just about learning study skills, although that's important. It was about test taking skills. Like these tests are not really worded, in a way that we could all understand it. And so just like getting used to how these tests are created, the wording of them, so that you can kind of figure out the answers a little bit better and spend less time reading through it. And I think the most important thing about that program was that it helped me to not feel like a victim of my circumstances, like growing up disadvantaged, growing up poor, single mom household, all of this extra work that I had to take on, and it sometimes felt like a burden that my other um, peers in college did not have to deal with. um, but but realizing that those things that I went through in my journey weren't things that held me back, but that they helped to ground me and helped me to grow stronger, more mature, earlier than perhaps other people. So that reframing my situation was, I think, the turning point for me, when I didn't feel like all of these circumstances um, were holding me back, but that I could reframe it. And so I did. And my personal statement is all about that. I talked about for my med school personal statement, I talked about growing up in a single parent household, how I worked when I was in high school, supporting myself and my mom, and supporting my sister later on when I was in college. And I just highlighted all of those strengths that I have, those things that really will help you to be a better healer and doctor if you choose to do that in the future. Having that maturity, having that resilience, reframing it as a strength, because it really is, you know. So after that program, I think that was 2007, that summer, I was energized. When I left there, I was like, I cannot be stopped. I'm gonna absolutely make my dream of being a doctor come true. So it was too late that summer for me to apply to formal post-bac programs. I would have to wait another cycle. So instead, I just applied for a second bachelor's at Cal State East Bay, which at that time was Cal State Hayward. And then I applied for a second bachelor's, but I knew that I just wanted to do 1 year of hardcore science, boost my GPA, and have more recent evidence for my med school applications that I could do a high level of science and thrive in it. So that's all I did for a year. All I did. I just, I just went to class, went to office hours, had a tutor, did study groups with other people in my classes. And then after a year, I had that solid 4.0 science GPA for college. And then I did my MCAT. I had a decent score on that just because I was able to focus. And then I applied to schools. I didn't have that much money, so I applied to, I think, like 6 med schools. And I also didn't have the money to fly out to interview, so that kind of limited me. But it worked. You really just need one school. You only need one school. It doesn't matter, how many you apply to. Of course, applying to more is gonna increase your chances of getting in. But I was able to get into a couple of different med schools. Now, being like solid in my identity and who I am, and energized. And so I decided to go back to UC Davis for medical school. That was in 2009 when I started. And then again in med school, I realized, oh wow, this is this is like a higher level of intensive learning that I wasn't used to. And then I realized that, again, my peers in med school, they, a lot of them had family members who were doctors or their parents, and some of them grew up learning anatomy and physiology at the dinner table, with their parents, because that's just how ingrained it was in their life. And for me, I didn't have that, so I was starting from a different place. So I had to get a group of friends who was in the same place as me, so that we could help each other and motivate each other. That group of friends was so awesome. We're best friends to this day. And so I found myself again in medical school. Had to get stronger. I had to learn some lessons. And then I still was holding on to that dream of being a family and community doctor. So I applied after I finished medical school. Then I applied to residency. So I did a family medicine residency down at Harbor UCLA, which is such an awesome program if you're interested in social justice work. I arrived there the first day and I was like, oh, this is my group. This is like, these are my tribe people, like we all had the same idea that we wanted to increase the health of communities of color in particular. And we had all kind of recognized that connection between um, health and success of communities. So yeah, I enjoyed my 3 years down there. It was rigorous working at a community hospital, a county hospital. So there's not a lot of resources, meaning there's not a lot of support staff. You just kind of get thrown in as the trainee. My first day, I was sewing up somebody's forehead. They got hit with a beer bottle on the head, and I was in the ER, just like, let me look up, let me look up in the textbook the kind of suture material I'm supposed to use and like how far apart they are. Um, but yeah, I mean, you have the book smarts, obviously, because you graduate from a medical school. But yeah, at community and county hospitals, you just kind of get thrown in and you just got to like think on your feet. And that's just the reality. There's not enough help. There's not enough resources. You have to do what you have to do to help your patients. So that was pretty much the 3 years. You're just like running around the hospital, putting out fires, saving people's lives. But it was great to do it in that environment, that supportive environment where everybody is like in it for the same reasons. And even in your really tired days when you've already worked 60 hours that week, you still show up the next day because your patients need you. So it's those little sacrifices, but for the greater good. And so yeah, after that, I wanted to come back home. I got a little bit tired of the LA traffic. And I figured, I can take my skills, any place. I'm gonna be needed any place that I go. So I ended up here. I got a job in Napa and relocated back up here. I've been here for a little over 5 years, working in primary care. I see adults, I see kids. I do. I did some training in acupuncture because I'm into wellness and different ways, different modalities to help patients heal. So that's been pretty fun. I talk to my patients a lot about nutrition. I try to listen to them. I don't just like throw my solutions at them. But that's part of the healer role is listening, assessing, and then figuring out the best solution for your patient's life and their whatever situation they're in. So I'm having a good time. um, so I wanted to lay out some tips that I have just in thinking back on my journey through medicine to this point. Um, Hopefully those can be helpful, and I'm open to some questions as well, however I can be helpful. So I just want to put it out there that I am old school. I still like pen and paper. I'm not very technical. So if you have a pen and paper, maybe on your computer, in a vertical kind of a line, like like down the paper, if you could write the word dream, so DREAM, maybe with some space between the letters. And then for each letter, I have a tip that may be helpful. So for D, I have here, determine what your specific barrier to success is and try to reframe it into a strength. So for me personally, my biggest barrier and things that it did relate to a lot of the struggles that I had early on in college and in medical school too, I think. But mine were the financial barriers that my family had, because it was just my mom and my siblings. And so I didn't have, a private tutor that some some students have to help them on their SAT or ACT when they were when they were applying to colleges. I didn't know anybody who had gone to college before me, so I was just doing what I thought I needed to do. It worked partially, but I had to realize that I needed other help. So like the financial barrier was a significant one for me. For other people, it may be being first generation student, or language barriers. And so you just kind of have to own it, and then talk about how you transform that into being a strength for you and how you're able to then help other people with that knowledge that you gained. Yeah, in my personal statements through medical school, I reframed that, growing up in a disadvantaged household, I reframed it as a strength. Like it does take a lot for somebody to still thrive, even though you're doing a full course load of work, and then you're working full time, and then you have other family responsibilities. It shows maturity. It shows that you're strong in a lot of different ways. It shows that you have resilience, which those are characteristics that you're going to have in order to be somebody else's lifeline, in order to help somebody else through their cancer treatment, in order to help somebody else through their chronic medical condition. So whatever it is that you feel like is your barrier to success, really think about it, and maybe ask other people who are in your life how they view you, because probably they feel like you're stronger than you see in your own self, and that's gratifying, to hear somebody else that you respect speak it out loud. So yeah, that's D. For R, I have reach out to get help. So, if you are starting not on an equal or equitable ground, then you've got to ask for help. And there was help out there, whether it's getting a mentor, getting a tutor, and I do want to say as well, get help if you have some kind of if you feel like you have some kind of learning disability or disorder. If you feel like you're studying super hard but you're not, if something's just not connecting, or you're not able to express on a test what you know, the facts that you know, then definitely reach out to a psychologist or somebody else who can help to diagnose um, something that you could probably be getting extra help for. There is a lot of undiagnosed ADD, ADHD, um, because as you rise through these different levels of your education, you may realize that you're no longer able to compensate, and maybe you have been compensating unknowingly, and then you just reach a point, and then you realize that you can't do it on your own, or you can't use your workarounds to succeed any longer. So definitely reach out for help, get a mentor, get somebody who is going to be on your side, leading you through when you don't feel as motivated, or you feel like you're losing your way. E, the next letter E, these are basics. Eat. Eat, work out, get good sleep, go to your doctor, have regular checkups. The very basic things. It seems silly, but you gotta pour into yourself so that you could be healthy and have the capability to study, to do well in school or in your career. So you can't just let that slide. Maybe if you're 18 or 19, your body can take a lot, but um, you will probably soon find out that it's not sustainable. So yeah, eat nutritious food, drink water, work out. You cannot be in the library all day long. Um, and to continue to do well, see your doctor, get a checkup, those basic kind of things. A is, this is my favorite one, attract a tribe, attract your tribe. You got to have people who support you. In my case, my family did not understand what I was going through in school. I would say to my mom, "Oh, I need to study," or like, "I studied, but I'm still not doing well." And then she would just say, "Study harder." And it's not like anything that you could understand unless you're going through it too. So, um, sometimes it does take longer than like an hour or two to study. Some days, weekends, if I had an upcoming exam, I would just study for like 8 hours or 10 hours straight. Um, and that's kind of what it took for me. Not all the time, but sometimes that's what you need, and you need people in your life who understand that and who support you and who are going to be there along with you. So that could be somebody who's in your actual major. um, it could be somebody maybe who has gone through it a little bit before you, and they could still kind of support you, like reach back for you and pull you, propel you forward. But you got to have somebody who's there with you. Otherwise, you're going to feel so isolated. And I think a lot of students who are first time college students, that isolation and feeling like they're so different from everyone else, it can get to them, and then they end up leaving. So that it doesn't necessarily have to be you. So definitely find a tribe. I also want to throw in there that you cannot isolate yourself within your group. You cannot be a silo. You can't just have like 3 friends that you only study with, like all the time, only hang out with them. You need to know what else is going on in your classes. Talk to other students too. Maybe you guys aren't friends um where you spend a lot of quality time together, but you need to know if you missed a day of class, or miss something, is there someone else in the class that you could talk to get that information? Or is there some other resource that you and your group of friends don't know about? You need to be able to ask other people. And it's a good skill to have too, to be able to find commonalities with people who maybe don't look like you or don't have the same background as you. Like get comfortable with those interactions and maybe make a new friend. But you for sure cannot survive and thrive at these higher levels of education if it's just you and your bestie. You know, you got to reach out and see what other students are using as their resource. And then the last letter in dream, M, this is find some time to mentor others. It may seem like a lot that you have on your plate at different points going through school, but it's easy to get lost too. It's easy to lose yourself in all of that, and not be able to see your path forward. So when you take time to give back and to mentor others, it reminds you why you're doing it. It reminds you of your passion, you know, because you have to explain it to somebody else. So then you're kind of in the same way explaining it to yourself. So find a little bit of time. It doesn't have to be a formal kind of a setup, but if you know somebody in your community or somebody in your family, or if you want a more formal kind of a thing, find some time to help other people get through the process and the pipeline as well, because it helps you. Ultimately, it helps us all to have a better community. I had a couple of mentors at different stages when I was going through school, and then now since I'm an attending, and I feel like not all mentorship is direct teaching, but just being present and having someone be able to look to you like and see themselves in you. You're the version of them that's, you know, maybe like 5 or 10 years ahead. It's it's an awesome gift that you can give, and it's not much of your time or commitment, but to those individuals that you're mentoring, it can mean the world. So if you have that opportunity, try to be a mentor in some way to other people. Just, you know, just talk, just be yourself, you know, be authentic. Um, and I think it'll be really helpful to others. Okay, so those are all of my tips. I don't know if anyone has questions for me, but I'm definitely open to explaining more, talking more.
Well, thank you, Dr. Jackson, for being here and for reminding us of the importance of mentorship, the importance of reaching out for help, the reminder that we need a crew, right? And that we shouldn't be only individuals, right? The sense of community is important, but also supporting and growing the next communities, the next folks to follow in our paths is really important. So thank you for that reminder. But yes, it's really a good time to ask questions. I see Dr. Munsami has her hand up, so I'll go ahead and pass it on to her.
Hi, Dr. Jackson. Thank you very much for sharing your story and your advice with us, our community. I was really interested at the very beginning of your presentation when you said, first you said, I always wanted to be a doctor, and then you revised that and you said, I always wanted to be a healer. And I'm really curious about what is informing that specific language that you're using, healer versus a doctor. And as a woman of African ancestry, I'm wondering, do you incorporate African traditional healing modalities into the work that you do? You mentioned that you are an acupuncturist, and that's coming out of the Eastern tradition. I'm wondering if there's anything coming out of the African tradition of healing that informs your work.
Thanks for your question. Yeah, I think that for me, I didn't have a lot of people in my life. When I was growing up, I didn't know any doctors. I only saw a doctor when my mom would take me, to my well checks, and I just saw like this person in a white coat, and my mom, obviously had a lot of respect for them, and then it was, implied that I would have respect for them, and then they just seemed like such a cool person, being able to help me. And so I just assumed that I wanted to be a doctor, but really I liked helping people. And I just chose to help people through this route. And then since I've gone through my training, I found that a lot of my successful cases are when I don't just give a certain prescribed therapy to somebody or medication to somebody. When I step back and I listen to what their concerns are, what their needs are, and when I give them different treatment options, Western medicine and maybe herbal treatments or acupuncture or therapy. And then we sort of form a solution together. I feel like those are the better, more robust success stories that I have, as opposed to me just saying like, I'm the doctor and I'm going to tell you that you need to do XYZ treatment. I I'm moving away from that. I have been for the last several years. And my role, I feel like, is just recognizing the dysfunction and then helping people to move towards health, but at their own pace and in choosing their own treatments. When there's multiple ways that somebody could be healthier, but I'm more of a facilitator for a lot of these things that are involving chronic conditions, and I'm less about me as being the one telling you what you need to do. So that's my kind of healer role, and I think people like that more so. Um, I I have done some study in herbal medicine. I've taken a couple classes through the center in Berkeley. I'm not, I don't know that much where I would be like an expert in it. And then acupuncture I did because I felt like there needed to be another solution. I did have, when I started my career, I had a lot of people who were on chronic pain medications and they needed another option. And acupuncture is so helpful, and it's very inexpensive. I could do it in my office right then and there, and then it helps the patient to also feel like they're more cared for. We don't do it as much now because of the pandemic, but prior to the pandemic, some people, they just need you to put your hands on them and to feel like you care about them. So that's part of my practice too. Um, I'm hoping to get more into it as things get safer. and then I'm also interested in working more, learning more. I don't currently incorporate a lot from African traditions. I'm still learning, but I'm open to that for sure.
Thank you.
I can't see if there's any other questions, Louise, but if you could read it out, I'm happy to answer.
I don't have any questions here right now. But I do see Ms. J saying, thank you for your presentation. You gave me food for thought for my Moja students in particular. It would have been good for students of color to hear how your journey led to where you are. So many similarities. I will share with the Moja students. Thank you and have a nice day. And then Michael Campbell created a Jamboard with your dream message as well. So thank you. And Joshua Murillo says, I love the DREAM acronym and all the aspects of life that incorporates. And then Dr. Alex Guerrero says, thank you, great advice. And yes, I agree with all of the above. If there's anyone else that has other questions, this is definitely a good time as well. Either raise your hand or feel free to also unmute yourself. Or drop it in the chat. I'm more than happy to read the questions as well. Jason Bell says, thank you for your words. I do have one question. If there was one thing that you could advise I believe there's a dean now, right, at the UC, a dean of equity or something of that regards over at UC Davis School of Medicine. What would be something some advice you would give that person to for others like yourself that end up there, right, that are accepted to UC Davis School of Medicine would benefit from?
Oh, that's a great question. I feel like I could talk for like an hour about that. I think that there has been a shift, in the last, I want to say like 10, 15, maybe longer than that, to get students of color into the pipeline. And I mean, we can all see that having doctors and other health professionals, this is just like medicine, but it applies to other careers and fields too. But there's definitely a benefit of having students of color, a more diverse class of students. It benefits not just those other students who are in the class together because they're learning from people with different backgrounds, but in the pipeline, it benefits patients to be able to see a familiar face or somebody who understands their culture. And certainly we could all, do the reading, do the studying and learn about other cultures, but there's something that cannot be translated easily in having somebody from your culture to be your doctor, to be your nurse, taking care of you in the hospital. Like there's just a connection that can't really be imitated, I think. And so everybody benefits from having a more diverse school, more diverse medical system. And so having students of color isn't a risky kind of a thing. Those students just need extra support. They haven't necessarily had all of those resources their whole life. But if we're saying that those students add something that we need for them to be there, then they need to be supported in a way that they can learn, they can thrive. And it's not a lot. It's not asking a lot. It's like having more tutors, having more study skills, teaching study skills, having somebody to assess for these learning disabilities. It's easy, and it's definitely worth it. So there is an effort to get more students of color into the pipeline, but they need to be supported at each point. Like I said, I struggled in college, and then I struggled again after I thought I had found myself and learned how to study that higher level in medical school. I still struggled again. And so they just need help along the pipeline. We all need help. So there could be more funding and more effort put into that. I think that, that's where we should do it. It's not the fault of these students. Yes, there's a little bit of personal responsibility, but if you're there, if you made it to that level, you just need to be supported a little bit more. And I don't think that that's a lot to ask for. So that's my 2 cents.
Can I ask a quick question, Elise? This is
sure.
awesome. Thank you again, Dr. Jackson, for your presentation. I love your acronym. I've seen a DREAM acronym before in the past, but yours was very unique and specific, so I appreciated that. I just wanted to ask a question more from a perspective of a professional now, working in the medical field. How do you handle or deal with the microaggressions or the macroaggressions that might occur on a daily basis, or perhaps you may experience at work? So what's some advice? Because that'll happen. It's going to happen in work. It's going to happen in school. It's going to happen across the board. But what advice might you give, or what are some ways you've dealt with those in the past?
That's a good one too. I'm a little bit more established in my career right now, and then I have some other priorities, like I have my child to look after. So for me, things like that, I'm able to let things go because I'm more grounded in other things right now. But when I first started out, I did feel a lot of that. I was injured a lot by that. It's hard to be the only one or one of a few, and it's hard to also explain to your colleagues what you're experiencing, because you don't want to complain, you don't want to make a big deal about it, but yeah, that sometimes does occur. I think having a mentor that's maybe more has been at that company for a while, or maybe not the same company, but in the same career track, to ask for advice, because nobody likes to discuss race or these other things that define us, and certainly not if you're the only one. So it's sometimes feels like a trap, if you bring it up. So I think it could be done in an artful way, a skillful way. I did a couple, maybe a year or two ago, I did take a course on diversity in the workplace. It was just an online course. It was for free. And it did break down how to talk about these microaggressions, how to talk about race in a way that's not going to be inflammatory. Ideally, you shouldn't need to explain it in any other way. Ideally, you would be able to have that freedom to say, like, this happened to me and it's not right and it's not fair. But if you're one of only a few people who look like you or identify as you, it doesn't have to be race. It could be like sexual identity or something else. But if you feel that you are the only one, then it can be hard to have the courage to talk about it. but it's important. It is important. So I would look to some of those resources about how to discuss those differences in the workplace, and hopefully that can be helpful. But it's definitely not easy. um,
Thank you. Thank you. It's definitely difficult to talk about those things in the workplace. I think many of us could attest to that here. And so thank you for giving us your point of view on that. And after all, we are working in institutions. You're in a different institution than us, but in a place like Napa, right? And so it's unfortunately bound to happen, but it's important, like you said, it's important to bring it up. But how you bring it up it has to be artful, like you said. So thank you, and strategic, right? So thank you for sharing that. Is there any? Oh yeah, go ahead. Anyone else?
Oh, I was just saying, definitely strategic, because you don't want to be the angry person or the crazy person. You still have to work and earn a living and all of that. And, there's I think a way to do it where everybody could feel like, they're not anxious in that talk, in that discussion. I think there's a way to overcome and to build some bridges, for yourself and for people in the pipeline coming after you.
Thank you. And then Professor Jennifer Aguayo says, thank you for sharing your story, Dr. Jackson. Thank you for all you do in our community. And then Dr. G, so thank you for your words. I appreciate your advice. We only have a couple minutes left, but I was wondering if there was one thing that maybe you didn't cover thus far, but that you wanted to leave our students with, in particular, even, our students that may come from some minoritized identities, right? In general, but even more specifically, our Black students, even at our college, one or the other, or in general, however you prefer to answer that. But what would be another, one like final piece of advice that you would give those students, whether they're trying to be a doctor or just just continuing on in their education?
Yeah, I think that when I was young, I had the dream of being a doctor. And now when I look back, it seems so silly. Like, why would I dream about having a career that thousands, hundreds of thousands of people have? But that was just like how I grew up. That was my mindset. I hadn't seen it before. And so for me, accomplishing that was my dream. And I had a lot of negative self-talk through my path that I didn't need to have. I had a lot of anxiety through my path about, like, what if I fail this test? What's going to happen? What if I don't get this A grade and I get a B instead? It doesn't matter. Now I have that perspective, of time. I can think back. It doesn't matter. Who cares? Who cares if you didn't pass that test? There'll be other tests you could pass. It's just like, it's so insignificant. Just like, stay focused as much as you can. It's okay if you deviate a little bit. Use those deviations, or whatever you consider little pebbles or stumbles. Those are all part of the process. It's growth. It's all forward momentum, forward progress. Use it, acknowledge it, and make it be a part, like an active part of your story, that you went through something, you got up, you kept going, and don't get so stuck in your feelings of inadequacy, because you can look ahead. You can see that other people have made it. Other people have been from your same community or same background. you can see yourself in other people, and sometimes you kind of have to do that. Like, other people believe in you, just ride that wave of, that confidence until you can feel it for yourself, until you could feel strong for yourself. Just keep going. Don't get stuck. Don't worry. Things will always work out. And so now, that I have made it to my dream, I could look back and say it wasn't so bad, and you could do it too. You could definitely do it.
Thank you, Dr. Jackson. Yes. Actually, because I have some of the same words, I might as well just read off some of these, because these, Dr. Moon Samuel says, thank you, Dr. Jackson, for your presentation. It was illuminating and inspiring. Sarah Malcos West, thank you for sharing your story. Joshua Murillo, thank you very much, and have a lovely day. And then Patricia Posada, thank you, Dr. Jackson, for sharing your successful pre-med path. She helps with our medical scholars program with Kaiser as well. So I take away a memorable presentation to share with students in my classroom. Thank you for taking time to share your personal grit, advice, and your practicing experience as a physician. And more importantly, thank you for being a physician. Thank you for coming here today, Dr. Jackson, and sharing your journey, sharing your words of wisdom, and just your commitment to our community. I see it all the time, and coming here today and speaking with us, with our community here, Napa Valley College community. And I'll speak on behalf of all. I'll just say thank you. Thank you for sharing. Thank you for being here, and thank you for representing as well in your in your field and in our community here in Napa. So thank you all as well for attending. Thank you,